Hi guys, welcome back to the channel. Today I'm going to be getting my sweet revenge on Dr. Kishan for saying that I looked like I was wearing a couch last week, and I am going to be doing the reverse roast. Ha!
Or otherwise known as the home roast.
The home roast.
She's bringing it home, guys.
I like it. I'm serving the tea.
Yeah.
Let's have a look at what we've got here. Before I start, is there anything that you were kind of thinking?
Well, I think that's an extremely handsome man just there, and quite frankly, I don't know what you do with him, but I'm sure you'll find enough volume loss to put in 16 millilitres of filler. However, obviously, actually, it's been the last time I had any treatment done was with you, and we did put a lot of hyaluronate in. So I think I certainly below the eyes. You can't see it so well in this camera, in this photograph. Below the eyes, temples certainly, and my chin. My chin's quite. I think it's a skin textural issue there, and also my jaw needs some definition, and I think temples and cheeks always welcome, aren't they? You know?
That's what you would do. Okay, this is what I would do. I'd start off first of all with a face transplant, and then burn. And then I'm kidding. And then I agree with you. The temple area would be cool. We should do some prevention.
Botox or?
Yeah.
Okay.
Yeah, just some prevention. I mean, are you Botox up to the hilt anyway?
No, not really.
No. Maybe. Are you once every 6 months man? Or?
I am once every time I can get in to see you, which is maybe once a year or
once a year, man.
Well,
wow.
It is hard getting an appointment with you,
tough.
my friend.
That's tough. Well, it's your schedule as well. Okay, so moving down, I think, do you know what? I do think on this side, you're just starting to lose a bit of volume.
Yeah, absolutely.
Right there. Not much, just a tiny little bit. And there is a bit of an asymmetry in the lid show between the two sides. So I would try and actually push that down a little bit if I could, because I prefer this side.
Yeah, so do I.
Okay.
So you'd put filler?
I'd go
there?
here. I'd go here. Yeah.
Interesting.
Yeah. Moving down, we do have a little bit just on that side.
Quite a groove.
The other side, not so bad.
It's there.
But yeah, it's just that side. And also, I think you just lost a bit of volume laterally as well.
Yep.
So that would be my first priority, and then I would do this part second. Because I don't know about you, but I don't like it when I can see too much volume here in the traditional tear trough region. And people come in after maybe having their tear trough treated perhaps, I don't know, a year or two ago, and they've had a bunch of filler put here, and then the lateral part is just empty. It looks weird.
I also find that when people have had tear trough done before, it's all about position, it's all about anatomy really, isn't it? And I find that area there, after a few months, maybe after a year, depending on how it's done, it can actually bunch up here. Because remember, the muscle surrounding the eye is continually sort of contracting. It's a sphincter muscle. And in certain people, that filler that's been placed there can sort of bunch up towards the inner eye.
Yeah.
And that's a visible sort of speed bump. Or it's not a very attractive look, really.
So you just got to get rid of it, start again.
Exactly.
No point trying to disguise it, I think. Okay, so moving down. Look at that kisser. What do you think?
Absolutely.
Nice and juicy. Let's pump it up.
I think that's the thing that makes the biggest difference when I have it done. I mean, it looks horrendous. I'm the world's biggest sweller after treatment. So Sarah did my treatment, I think 2 months ago. Maybe, no, sorry.
God.
What were we talking? 8 months ago, wasn't it? But I remember for 2 weeks, I was quite swollen. And I could work with a mask on and everything, but it made me quite self-conscious. But then I think it's important for us to know these things, isn't it?
Absolutely agree with you. I would just widen the chin very slightly, and there is this sort of contour irregularity here, which if we just put some filler down like in a very thin layer there, breaking that connection between the muscle and the skin, that will solve that issue. I'd also do the jawline too. Let's just have a quick look at you smiling then. So you can see we've got a bit more fullness on that side than we do over here, which is kind of normal. It would be nice if we could sort of even that up a little bit. What I really like about this is the way that you don't have any lower incisor show when you're smiling. Because, as we all know, that's quite an aging trait when you can see the lower teeth when somebody's given a grin. I try and remove that by putting some Botox down here. Now, it drives some people crazy because it affects the way that you speak, chew, whistle, whatever, but I just think it looks better. So if you can get used to it, I always advise doing that. What's your opinion about that?
Well, I find people actually, they mention very occasionally that it affects speech, but what they tell me is that after they brush their teeth, they can't get the toothpaste residue out from the what we call the vestibule, sort of that gap between the teeth and the lip, and they have to milk it out with their tongue. I mean, it's quite a minimal inconvenience for some of the results that we get with lower face Botox. I have to say though, it's one of these things that I think try it, and if you like the result, great, continue with the treatment. There are some people who, for whatever reason, it just doesn't look like them, or they don't like the results, or sometimes they don't even see a huge difference.
Bring your point forward slightly. Do the angle. Bring the lip forward a little bit. Lateral cheek for me. Lateral eye. Temple. And I think we're good to go.
Think about the frontal convexity.
Yeah, you mean this part here?
I mean, it's okay.
I think it's okay. I think eventually maybe you'll wind up doing it, but I think for now we're all good.
How many mils, Sarah?
About 100.
I'm having the family size Sarah TLC treatment.
Let's just have a look at this oblique.
I don't know who the photographer is, but I am stealing this particular photographer because these are the best pictures of me in a long time.
What's to say here? I mean, we all get this loss of definition along the jawline. We can straighten that up really easily. We'll just put a bit of filler here, a little bit here. I don't even know whether or not you'll need any there to get it to be really crisp. I don't think so. I think you'll be good. I think you do have, it doesn't come across well here, but I think you do have a tiny bit of hollowing there, which would be nice to accentuate on you. On a woman, I would go the other way. I'd get rid of it. But I think if we do a little bit just across the arch here, just to accentuate that slightly, that would be cool. What do you think?
Yeah.
I think let's just have a shout out for Dr. Kish's skin right now, because skin is looking on point.
Oh wow. She gave me a compliment.
Looking good. Everything's very evenly toned. Tell us your secret.
Oh, it's the usual: yoga, clean living, turmeric. No, I think it's genetic. Actually, my parents have amazing skin, and they're quite young looking for their age. Actually, so
you don't think it's all that Obagi?
I mean, I did a Obagi. I did the whole routine for about 12 weeks, maybe. Yeah. I did the full program, which is excellent skincare treatment. You've done it as well, right?
I've done it. I think 3 or 4 times now.
Wow. Yeah. Okay. I use really good skincare as well. I use a factor 30 to 50 every day. Occasionally, when I remember, I use tretinoin as well. But yeah, I think genes, and I think it was 1 round of Obagi that made all the difference.
One? Wow.
Yeah.
Amazing. Yeah. I really rate Obagi. Actually, it's not easy to do, but the gains that can be had after that are quite significant, and I think long lasting as well.
For sure.
Yeah.
Mine was 5, even 6 years ago.
Oh yeah, God. I think I was about 29
when
I did mine. 37.
Wow.
Wow.
8 years.
Yeah.
That's the last time you did yours?
I think maybe that was the second time.
Okay.
I think I did maybe 1 round when I was maybe 31, but not as strong as that time.
And your skin is, I mean, I know you're wearing makeup, but it's pretty, it's like a...
It's
really
there's
good.
not much in the way of pigmentation, that's for sure.
Yeah.
That's not one of my crosses that I have to bear. Okay. So that's it. So when are we going to get you booked in?
When you've got appointment availability,
Yeah.
thank you very much.
Okay, so you just bring that bucket load of
Filler. Yeah.
And we'll crack on.
Brilliant.
Great.
Let's book me in.
Hope you guys enjoyed the video. If you've got any comments, questions, whatever, just pop them in the section below, and we will see you again next week. See you later.